Dr. Murray Cohen, Jerry, worked 20 years for the CDC. He is what you would call an expert, and he joins us now.
He does. Good morning, Dr. Cohen.
And good morning to both of you.
Now, do I recall correctly? I think if we didn't have you on the air, you were on a lot of national shows with the whole Ebola pandemic, were you not?
I'm the same guy, yes, sir.
That's what I thought. Yeah, you were with the CDC for how long?
21 years.
21
and then with the World Health Organization, working with them for 10 years after that.
Wow.
When people talk about Ebola and other viruses we've had, and this one's worse than the other one, and I think it's kind of reckless to start comparing them because they're all different at different points. But with this coronavirus, are you surprised how big it's got and the media attention it's received?
Not at all. We've actually been preparing for this a long time, supposedly. The first task force I was a part of at CDC was back in, 1992, where we put a report together on the problem of emerging pathogens and what we might be expecting. And sure enough, unfortunately, we were right.
Dr. Murray Cohen is with us this morning talking what else, Corona. Were you familiar with Dr. Fauci before COVID-19? You must have been, right?
Oh, yeah. I've been Tony for a long time. Actually, we met for the first time back in 1989. He was still in the position that he's in now, the head of National Institute for Allergy and Infectious Diseases at the NIH, and I was at the CDC chairing a national HIV/AIDS conference with the Surgeon General Koop, who I worked for. And then I spent a lot of time at the NIH in the last, since anthrax in the male. Excuse me. I did cough into the crux of my arm, by the way.
Okay. And you called Dr. Fauci Tony. Yeah. I'm impressed by that. Yes.
Hey.
Well, I had an office down the hall from him for a couple of years at the NIH in Building 31. So, it was, we bump into each other in the men's room, that sort of stuff.
Yeah. Right.
Hey, what's your thoughts? And I know the World Health Organization has taken a lot of heat. Do they deserve it?
Yes and no, but like all institutions, it's imperfect. But it's what we got, and the option of not having them is worse than whatever's wrong with it. And just jumping ahead, anticipating your next questions, what's wrong with it from our perspective in the United States is the same thing that's wrong with the United Nations, because it's a United Nations agency. So it has all that underlying United Nations politics, which certainly doesn't pay enough attention to things like infectious diseases, just like, frankly, our own politics hasn't really paid enough attention yet, but they are now to infectious diseases.
And you're calling from Panama. You're kind of self-quarantined down there. Is it similar? Is it similar to our situation here? I mean, you see, on satellite or the same news we do. What do you think? What's going on here? Are we through the worst of it?
I'm afraid not. We're probably getting close to the worst of it, but I say probably because we don't really know. To me, the worst mistake we made. And we here is to blame, as far as I'm concerned, equally with the FDA and the CDC, is we didn't get onto testing, and we didn't get onto the right kind of testing. What we have is diagnostic tests where they actually measure the virus when you are infected. What we need for public health surveillance purposes is an antibody test where you can determine with a very simple, cheap, fast, almost like a home test kit, who has been infected and developed antibodies and is now resistant, as far as we know. That's what you need to know about how much disease is in the population. CDC and FDA blocked that kind of testing all of January and February. FDA, as far as I know, when they finally approved one such test last Friday, was the first time.
Wow, yeah.
So, and they're rolling those out. They're rolling those out soon, correct? And how hard is it to get? How hard is it though? Because we had a hard time getting the tests originally, and we were told, hey, they're going to get here, and then they delayed in that. With the antibody test, can they roll out 20, 30, 40, 50 million of them?
This is America. We can do anything.
I like that.
Should be able to roll out 150 million. Let me tell you how simple this test is. And by the way, they were doing this in China and Singapore and South Korea in January. And we had the opportunity here to do it, and we turned it down. FDA, in fact, very famously blocked an initiative by the Association of Public Health Laboratories to develop and do such testing. And they said, nope, you can't do it. So when it comes time to do a postmortem on this epidemic, those are going to be some of the bodies that unfortunately we'll look at. But for now, we just need to get on it. This test is simple. It's like it's called a serology test, meaning they're measuring blood. So typically, it's like testing your blood sugar. You take a little prick of a finger, you get a drop of blood, you mix it with a reagent, stick it on a strip of paper, and then you see what color it turns in 10 minutes. So that kind of test could be a home test kit. Certainly, to me, the smartest thing would be to roll it out like we do flu shots, because we get 100 million of those out, within 3 to 4 weeks during flu season in September. And you do it through hospitals, through LabCorp test places, through pharmacies. So all we got to do is push this new product into the same supply chain that we've already got, and that should be pretty easy.
Yeah, we're talking with Dr. Murray Cohen, formerly of the CDC and the World Health Organization. How effective, wear them, don't wear them. Now you see everybody, the mask. I know the distancing has been proven effective. How about the mask?
Well, the mask is very effective for what it does, but unfortunately, a lot of us are misusing it. So let's talk about exactly what it does.
Please.
The N95 that we talk about is a healthcare worker protection mask. That's designed to be the same protection from viruses and bacteria for healthcare workers that industrial respirators are for dusts and mists and fumes, in factory workers.
Okay.
So it's specifically designed for that. That means the wearer of that can be in the midst of an entire storm of, airborne storm of virus and be protected. A surgical mask or any other kind of mask doesn't do that. It doesn't protect the wearer from inhaling particles. What it does is it prevents someone who's infectious from spitting out, frankly, from exhaling out the virus. So it's really used to protect everybody else. In this circumstance where the epidemic is now, since nobody even knows if they're infected, and we do know that certainly 25%, maybe as many as half, of the transmission occurs from people who are asymptomatic. It means they don't have any symptoms yet. It's very early in the infection, and they could be shedding virus and infecting other people. So that's why we really have to wear it.
Yeah.
And the reason.
Go ahead. I'm sorry.
Go ahead.
No, go ahead.
I was going to say the reason for the 6 feet has to do with aerodynamics. It's like how far can you sneeze or cough or spit or talk one of these viruses out in a particle that can hurt somebody else. And the aerodynamics is complicated, but generally speaking, probably 4.5 feet is as far as it's going to go, and it's not going to linger and float around in the air like influenza, because these virus particles are called droplets. They're too big and heavy. They're like wet soggy raisins in the air. They're not like dust that you see in a sunbeam.
Okay.
Yeah.
So that's the secret. By the way, I got to tell you something funny, because I know you guys are pretty funny.
We'll take funny, Doc.
One of my best friends down here in Panama is a retired Navy. He's an Annapolis Academy grad. So he brought me this poster that somebody mocked up for the epidemic. It says, due to COVID-19, the Navy Blue Angels will cease operations because they cannot stay 6 feet apart. The Thunderbirds will continue operating at their regular schedule.
That's good.
Well, he's a Navy guy.
Yes, yes.
Yeah, I get it.
Exactly.
Yeah.
Well, I thought that would fit with you guys. We were talking yesterday to fishermen, I guess.
Yes.
The deadliest catch, yes. Hey, Dr. Murray Cohen's with us, and I wanted to ask you now, I have a family member that's a top, runs an ER for a university, and he wasn't endorsing this, but I was having a discussion about Sweden with him, and he said, listen, I'm not saying they're doing the right thing, but as a doctor, I'm really interested in the herd mentality to what becomes of this, how they are, is their countries, what's going to happen to the virus there compared to other countries. As a doctor, are you kind of looking at Sweden kind of with eye open, kind of interested in what happens there?
I don't personally know anything about Sweden. So
because they don't have restrictions like we do. They're taking
lockdown.
Yeah, they're taking the herd mentality as their stance.
Well, when you say herd mentality, I think what you're probably referring to is herd immunity.
Yes,
and that's the way that vaccines works. Let's talk a little bit about that. I don't want to get too geeky, so kick me.
Okay.
But the reason we're able to live and survive in a world that is frankly the microbes world, the viruses, the molds, the bacteria, there's so many billions of them, and there's just not that many of us. This is their world. So we have to survive. We live all day, every day in an equilibrium with all of these microscopic organisms that are challenging us. And we do that because our immune system keeps us in balance. When we get out of balance and we start losing, that's when we get sick. That's when we get an infection. So, and the way the immunity works, once you're immune to these viruses anyway, you develop what's called immune memory. This is how the flu vaccine works, for example. It gives you the shot, so your immune system is primed to look for that particular challenge. And then if and when it sees it during that flu season, it immediately gins up, to produce so much more immunity, and then you win. You don't lose that fight at that time. Then you're immune for the rest of the year, roughly speaking, to that flu virus, those particular strains that are in the vaccine. So if you're the flu, from the perspective of the flu, and you're out looking, trying to propagate yourself and trying to find somebody to infect, you got to find somebody who hasn't already been infected and become immune naturally, or who hasn't got the vaccine. So the herd is when you've got the herd, the population, immune, then the virus doesn't have anybody left to infect. And so it dies off. That's the end of the run of that particular epidemic.
God, yes, it does make sense. In Sweden, small enough to be able to probably
10 million
pull that
people,
off,
yeah.
as opposed to our 320 or whatever million. Yeah, that makes. If I had to boost my immunity, is there what one supplement would I take? Maybe?
Quit drinking, Jerry.
Would I? Yeah. Is it zinc? Is it vitamin C? What does the average person do to boost their immunity if you're in middle age?
I'm sorry, that's not my area of expertise.
Well,
yes.
make something up. Make me feel good, doctor.
I'm not that kind of doctor. I will tell you what I have said, though, somewhat jokingly, and then a bunch of us were talking about it, and it's probably not a bad idea. The particular coronavirus that causes COVID-19, and the reason that it spreads so well asymptomatically is because once you don't really inhale it down into your lungs. You get it into your nasal passages, you get it into your throat, you get it into your cheeks, just in the course of normal breathing, and it starts to multiply. The cells that it likes to invade live in these mucous membranes of the human body. So already your immune system is ginned up. When you don't get sick, it's because your immune system is fighting them off, just like all the other junk, that you're getting into your nose and mouth when you take a breath. What it does, it kind of takes residence in your throat. And when you get sick, it's because, it starts winning the battle against your immune system, and then you breathe it down into your lung. To get to your lungs, it has to go through your throat. So that's why a sore throat is usually, not all the time, an important early symptom. That's why a slight fever, perhaps 99.5 Fahrenheit, is where you start to have a bit of immune response, but you don't feel bad. We call that a low-grade fever. But that's where your immune system is heating your body up to try to make an inhospitable environment for the virus.
Oh.
And so during this time, I'm sure you read a lot of home remedy things about gargle with warm salt water. I happen to like gargling with lemon water or even a normal mouthwash to clear your throat so that whatever might be stuck there and starting to colonize, you clear it out and spit it out. So I thought, maybe I should gargle with my bourbon every night.
Yeah. Amen to that. Amen to that. There's nothing wrong with the Woodford Reserve gargle.
I'm an N of one, a study subject of one, and so far it's been working for me, gentlemen.
Yeah. Now, obviously, Dr. Cohen, you can't, they say, well, it's not safe and we're not going to be back to normal for 18 months. And that just, the reality is that just can't happen. You can't sit in your house for a year and a half. But what should they do? If you were on the president's counselor talking to one of the governors, what would be the best path? Or maybe you don't have the answers, but what are some of the things we should be doing once, May 1st or May 15th happens?
My crystal ball gets real foggy after about lunchtime today.
Yeah.
That's where the bourbon kicks in.
You're on Panama time.
but I can make some. Epidemiologists are, often called sayers of sooth. Or one of the curses is we can see the future, and there's usually something ugly we don't want to see.
Yeah.
Because that's what we're trained to do. We look at data and where we've been, and we try to figure out where's it going. So I've got some pretty clear pictures of where things are going, irrespective. However the governors and the president, do things. What we know is there's going to be continued spread. Hopefully, we won't start getting people out and about prior to the amount of spread, what they call it flattening the curve, tapering off, et cetera. A certain amount of that is because of herd immunity. There's so many people who have gotten infected, and we don't have any clue who they are because we haven't done antibody testing. Well, we're going to start doing antibody testing, and that's going to give us some pretty solid data pretty quickly, I think probably within 4 to 6 weeks, of where the epidemic's been, and about what kind of percentage of the population is actually infected, who the higher risk groups are, instead of just guessing. The data we have so far, the tests for diagnostic purposes, are useless for these kind of public health concerns. Useless. First of all, it's only getting you when you've got the virus, and you could be negative this morning and positive this afternoon. And we don't even have a case definition, which is the first thing for epidemiology. What do we call a case? Every state's got their own definition of who gets tested. We've got 50 different case definitions. It's ridiculous. But that's going to all start coming back together. You asked about the future. We are going to start going back to work one way or another, and work is going to be very different. I know you guys mentioned Larry David. You made fun of my name yesterday. I should be Dr. Analytics. I got something to say about that too, by the way, just to digress. When I was in Atlanta at CDC, there were 3 Murray Cohens in Atlanta. Back then, there were things like phone books, and in the New York City phone book, there was an entire page of Murray Cohens.
Sure.
So I'll be happy to go on Larry David's show anytime.
Well, thank you for your time this morning. It was very enlightening. We'll end with this. Do you think we're learning as a country lessons or maybe changing policy permanently that will benefit us in 30, 50 years if there was bioterrorism, let's just say? Or is this helping maybe long-term along those lines?
Sure, absolutely. And it's not going to be 30 years. It's going to be 3 years. Things like hand washing, which has always been needed and never been done. I think people are going to get used to washing their hands a lot more.
I'm even using soap, Jerry.
Yes, Torch started using soap.
I think that handshakes are probably a thing of the past. My grandkids will see movies, people shaking hands, and laugh. Say, what's wrong with those people?
Yeah.
There's going to be new kinds of ways of greeting. I think the kind of telecommuting that companies and employees for so long have said, oh, we can't do that. Well, guess what? They're going to say we did that, and our quarter looks pretty good. So things like holding meetings, a lot more technology is going to be used for stuff like this, a lot less direct interaction. I think that's going to make our lives less stressful, hopefully, and probably our businesses more efficient, hopefully.
Well, we're going to keep your number here in studio. You're going to be our go-to guy.
I am happy to talk with you anytime.
All right.
I appreciate the opportunity.
Thanks you so much, Dr. Cohen.
Thanks, Cord. Thanks, Jerry.